Hello everyone, I'm an immunologist based in Bangalore, and in the next 2 minutes, I would briefly touch upon a very important topic, and that is COVID vaccines. As the government of India has now rolled out vaccinations for all adults in the country, it is important that we clear the myths and understand a few facts about these vaccinations. Vaccines in general are given to induce immunity. They produce T cell and B cell responses and result in production of antibodies which protect us against a future attack with the particular infection. We wish to get a long lasting immunity with memory production from these vaccines, and that is what is expected out of the COVID vaccines so that we are protected against a future attack. In general, there are two types of vaccines, the live vaccines and the killed vaccines. And as doctors, we know live vaccines are contraindicated in immunocompromised patients, while killed vaccines are safe in immunocompromised patients. And this is very important because the currently marketed vaccines, both Covishield and Covaxin, are safe in immunocompromised patients. Who should be vaccinated? As per the current recommendations, everyone above 18 is eligible for vaccination. What should be the interval between the two vaccine doses? In general, it is recommended to be 6 to 8 weeks, but at least more than 4 weeks. An interesting question. I have received the first dose with Covishield. Can I take Covaxin as the second shot? Preferably no, because we do not have such studies. However, in the West, studies have been carried out or are underway to see if we can do this mixing of vaccines and produce a better results. But until we have results, preferably go for the second shot of the same vaccine. Got recently a COVID infection. Should I vaccinate? Yes, all those who have got COVID infection must be vaccinated after recovery. And this is because the immunity that is produced out of vaccination would be long lasting, and we know that people who have got COVID infection are still prone to second attack of COVID, and that is why vaccination is mandatory. However, the government of India has clearly stated that one should wait for at least 4 to 8 weeks after recovery before getting a COVID vaccine. And the CDC from the US states wait for at least 3 months if you have taken plasma therapy or exposed to monoclonal antibodies during the COVID therapy. And one should not perform an antibody test to check for previous infection. So please go and get vaccinated, but preferably wait for at least a month if you have recovered recently from a COVID infection. Pregnancy and lactation. The American College of Obstetrics and Gynecology guidelines and the FOXY guidelines from India state it is better to vaccinate pregnant women and breastfeeding ladies. However, there are no studies so far that have been conducted on these group of people, and that is why it would be better to counsel them and take an informed consent. But I personally believe the benefit outweighs the risk, and these people must be vaccinated. There has been a lot of misinformation on the internet regarding menstruation and vaccination. There is no relationship between these two. Please vaccinate. Even if during this period of menstruation, there is no relationship between menstrual cycles and vaccination. Please go ahead and vaccinate. And if people who are on immunosuppression, people who are immunocompromised, must be vaccinated, because these are the people who are at maximum risk of developing severe COVID, and this should be a priority. But then one should consult. I would request you should consult your treating doctor to see if some of your medications can be stopped temporarily to improve the efficacy of the vaccine. And my last request, avoid mass gatherings to get vaccinated. Vaccine-induced immunity develops only after 2 to 4 weeks after vaccination, and there is no point in getting the infection while you're getting vaccinated. Stay safe, take care,